little bit about where did it come from, why some people are surviving and others are not.
Yes, those are actually all the questions that I have to ask you. Let's start with that one, the last one that you just mentioned. Where did it come from? Because I did hear a few things, and just you tell me what you have.
All right, so where did it come from? It originated, they think. So the novel coronavirus first was reported in Wuhan, China, it was in back in December 2019. So it was identified there were several cases of pneumonia that had come from an open fish market in Wuhan. And then later, of course, things spread, and so the origins that we're aware of right now came from an open air market in Wuhan, China.
Okay.
And the derivative is, so it's still not barrier. And that's exactly what happened. Now they're saying that when they look at the DNA strands of the virus, they're showing similarities to bats, but they're also showing similarities to several other animals as well. So again, part of the reason why we don't have a vaccine yet is because we still don't know the exact origin of the virus itself. We have components of the virus within the DNA structure and sequencing, but we do not have the specific viral code or DNA RNA code. Therefore, we can't produce a vaccine. Okay?
One of my other questions, I don't know, do you have anything to add to that, Jessica?
No, I pretty much have looked at research on similar lines and looking at it definitely crossed over from animals. And that's where when I talked with students about the livestock and all the problems that come from livestock with all our chickens, you know, being where they can't even move and they're stuck and they're right near cows and, you know, everything else, and mixing all these animals isn't good for them or for the environment or our own health. And so especially in these wet markets that they have in China where they have all kinds of animal remains together and they're mixing the blood and everything. When she was talking about a wet market, that's what we're referring to, is where they have all these dead animals they're selling, and they've seen other times that viruses have jumped from the animals to humans.
Yes.
So I think it has to do with us just having better practices towards animals and better health in general for ourselves. I think that we've just seen it sometimes, or what we're looking at, the origins for some of them that we found have been these wet market things.
Okay.
So I think in general, when we talk about extinction rates, I guess that's where I mentioned things, especially over in China where they're selling endangered species and things. I think in general, for a lot of reasons, those markets need to be examined and their practices. I don't necessarily think we can slow down the evolution of bacteria or viruses because we've greatly caused those to speed up with other practices. So I do think we need to be careful, but I don't think scientists will never be able to work as fast as a virus or a bacteria can evolve.
Okay. So you mentioned that if we catch it again, like how does it affect the body? It impacts the lungs. We know that, connected to as far as SARS. Can you repeat that if you said it?
So
what it will attack in our bodies?
So we're seeing a very broad range of syndromes, if you will, within the body, which is, this is a bit more uncharacteristic than other viruses that we've had in the past, because the range of symptoms is so broad. So you have the normal, let me just get back into my notes. You have the symptoms of the fever, the cough, the chest congestion, the fatigue, headache, backache, diarrhea, the shortness of breath. So all of the respiratory things, some people have them, some people, they're worse in some people than in others. Those are some of the normal symptoms, if you will. Some of the other things that are even more concerning are that we're seeing blood clots all throughout the body. And so the danger of having blood clots obviously is twofold. Because if you're having an emboli, and an emboli is a clot in the lungs, okay? That's what we call an emboli. It is a blood clot. It's just another name and where it's located. We're seeing clots in the lungs. We're seeing clots in normally healthy patients. So this is why, originally, when this virus first came out, we anticipated originally that it was going to hit our elderly population the hardest, because they would most likely be the ones who had weakened immune systems. And ironically, what we're seeing is that is not at all what happened, that it actually hit the age ranges from between late 40s into the early 60s the hardest. That's a very, very large population of people. But it's hit all categories, but that particular category has been hit the worst, along with the fact that African American, Black African American, and Hispanic have also been hit the hardest with this virus. And we're not exactly sure why that is. But some of the symptoms that we're seeing are these blood clots, which so the clotting is actually, so it's associated with the immune system. It's an immunoresponse. It's an inflammatory response. When you see clots, that means that there's an inflammation occurring inside the body, in particular inside all of the blood vessels of the body. So every vital organ in your body is supplied by these blood vessels. Mm-hmm. And what's happening is we're seeing blood clots throughout these vessels. And because of that, it's an inflammatory response to the body trying to fight off the virus. It's creating these blood clots. And because these blood clots are in so many of the vessels, that's what's leading to total organ failure, your kidneys, your lungs, your heart. So we're seeing vital organ shutdown with this virus, So yeah, so this is, and these, by the way, so I've interviewed people, I have friends who are young, healthy, in their 30s, the epitome of health, clean eating, nothing wrong with them, who have had this virus. In fact, a friend of mine in Pittsburgh, she's 35 years old, the epitome of health. And she exercises every day, she eats clean. She is on day 59 of this virus, and she's been in the hospital 3 different times. She now has pulmonary complications because of the virus. that we don't even know. This is ongoing now. So normal, healthy, young people are being affected and are dying from this virus. You know, people are, the naysayers are like, oh no, this is hype. No, it's not hype. It's real and it's happening. Patients who have other comorbidities, such as cancer, heart disease, you know, kidney disease, other disorders, they're going to be primarily more affected. But that's not to say that the healthy population isn't being affected as well, and are coming away with things that they didn't have before the virus. And so what these clots are causing, it's causing, well, in children, in pediatrics. So let's just move on to the pediatrics.
So children are getting this as well.
Yeah, children are getting what they're calling multi-system inflammatory syndrome. And that's characterized by a persistent fever, inflammation, poor function in one or more of their organs, and other symptoms that resemble shock. In some cases, these children, they're having what's called Kawasaki disease. And Kawasaki disease involves the inflammation in the walls of the medium-sized arteries. Again, same thing, that can damage the heart. So we're seeing this more in children now. It also causes that immunoresponse that I talked about in adults. What's also prevalent in, we're seeing it in children, and it's called, what they call it is a cytokine storm. And that, again, it's a severe immune reaction where the body releases too many cytokines. That means that the body is trying to fight off the virus. So it's sending out all of these helper T cells and different types of cells to attack the virus, but it's sending too many, and the body is reacting negatively to the good things that are trying to fight off the virus, which is causing this inflammation process, and which is, this is what's causing a lot of damage: heart, lung, kidney, your vital organ damage in children, in adults. So there's actually another also less reported, but we're seeing more of this. It's called COVID toes, like toes on your feet, that patients are also reporting that their toes are swelling, like purple, red. Again, we're surmising, these are blood clots, but it's less damaging, but nonetheless, this is another side effect that we're starting to see. I'm seeing other things. It's kind of crazy because this virus acts almost to me like a little bit like sickle cell anemia in some respects. It's also acting a little bit like malaria. So it has these really odd components to it that are causing things that we're just now starting to recognize. And we're actually involved in the Mayo Clinic study. All of our patients, we're doing convalescent plasma as part of a treatment. There is, Emory, we're working in conjunction with Emory to take a look at the drug that, again, these are not cures. They're tools for the tool belt to combat. So all of our patients, when they're diagnosed now with COVID, they have to be on blood thinners. There's a battery of things that we're treating these patients with to kind of combat all of these symptoms. Some of it being ventilators, some of it being antibiotics, some of it being, convalescent plasma. And that holds, so the convalescent plasma is given from patients who have survived COVID and are now donating their plasma because they've built up some form of antibodies. But again, because there are multiple strains of this virus, some antibodies are more prevalent than others. It also depends on what kind of a viral load the patient received, which is why we don't really know, can we catch it again after we've had it once? You know, we don't know. We simply don't have the answers to that right now.
Wow. So what do you think, you said a lot, and it makes me, I wanted to ask you about what can we do to protect ourselves. And I'm listening to you and just thinking, oh my goodness, I need to drink more turmeric? Oh, I have to take aspirin. What do you think that we can do, to maybe prepare our bodies if we do catch it? And do you see this really, I like the way, since it's airborne, it's really scary, but should we wear our mask? Should we wear gloves? Should we have the antibiotics? Should we really be that scared, or that I myself have gone out without a mask, and I feel like, really, is it this serious, But listening to you now, I really feel like it's really serious.
Well, it's very serious.
And as far as also the fact that Latinos and African Americans are the ones who are catching it even more, and I'm both, so just, you're saying wear the mask.
Yeah, so there's a lot of conflicting information. First, you're supposed to wear a mask, then you're not, then you are, then you aren't, right? So our policy and my personal common sense tells me that if I'm wearing a mask, I'm going to be protecting part of okay, so understand this, the virus is airborne.
Yes.
But it's also contact. So when someone coughs or sneezes or touches their face and then they touch another surface, or when they cough and sneeze and that sprays everywhere, it's going to land on surfaces. And it lives on your clothing, it lives on tables, it lives on anything that it can attach itself to. So not only is it airborne, i.e. wearing a mask will protect you if someone around you is sneezing or coughing on you, right? But you also have to think, and this is where people are making their biggest mistakes. They're going out to the grocery stores are probably one of the worst places you can be, because people are going in, some people are wearing masks, some are not, but they're touching things and they're not thinking. So here's the problem when people are going in and they're wearing their gloves and they've got their mask on and they think they're protected. The problem is you have to understand how not to cross-contaminate. So if you've touched something on the shelf, you've got your gloves on, you've got your mask on, and you touch something on the shelf, and now, okay, you've just made contact potentially with the surface where that virus is living. You picked up a can of beans to read the label, you don't want it, you put it back. Now, you have potentially become contaminated. So what are people doing? They're digging in their purse with their glove on, they're talking on the phone, they're handing out money. So you have now cross-contaminated everything on you, in your purse, then you're going to get into the car. So taking the glove, and a lot of people don't understand how to take the gloves off. Mm-hmm. So that's the biggest problem. So in answer to your question, what can we do to prevent it? Stay home. Stay home. Don't touch your face. Wash your hands. Keep your hands away from your face. Limit exposure to other people, especially in large groups, because this virus spreads like wildfire. People are sick and they don't know it. I've had patients who are beyond 3 months still testing positive with this virus. 3 months. They're feeling better. They think they're better. They come in, we test them. They still have the virus. And that's the other deadly thing about this virus is that I screened 2 patients last week. It was a husband and wife. The wife wound up with pneumonia. They sent her home to heal at home. They didn't keep her in the hospital. The husband also had it. He had it for 10 days, and he wound up, he was retested after 10 days. He didn't have the virus anymore. He was cleared. The only symptoms he had was a slight cough. Never had the sore throat, never had the fever, the chest congestion, all of that other stuff. She, however, had pneumonia. Now, she also is a breast cancer survivor. So her immune system, of course, has been compromised because she had high doses of very severe chemo. But it took her over 3 months before she finally tested negative to the virus. Now, she's healthy and well now, but we don't know what residual effects are going to happen to anyone who has had this virus. We don't know.
All right. So some of us could be walking around with a little cough and we may have the virus. Is that what you're saying?
And you might not even know it.
And some people, and how can we get tested? Because I remember it not being available to us. Is it easier to get tested now?
Not unless you're showing symptoms.
Okay.
So we still have limited tests. So we have to save those for the people who are showing symptoms. So this is what I've done. Back in January, early February, I suspect that I had this, but I was never tested for it because at that time it wasn't supposed to be here. So now that they have the titer, the antibody testing, it's a blood test. It's just a simple, quick blood test. You can get it at, all of our urgent cares are doing the test now. If you suspect that you had the virus, if you had symptoms that give you cause to think you had the virus, you can go and get this antibody test to see if in fact in your blood you're showing antibodies against the COVID virus. So I should know my results by Friday. Now, I have been exposed to this virus on more than one occasion, very up close and personal. So I haven't, since that time, I haven't exhibited any symptoms. So that's really the reason why I'm going to be tested, because I suspect that I may have already had it. So.
Okay. Schools opening. Do you think schools are going to open, Ms. Samson, for next semester?
So right now, schools are preparing contingency plans, and most schools are coming up with 3 different ways that we're going to approach things. So no one really knows, because we could open for a month, but if what happens, like scientists are now predicting that we'll have a huge wave again in September. So even if we opened for August, we'd have to close again in September. And so some are preparing for that, because at least we could get students resources during that month, like hand out the Chromebooks again and make sure they all have hotspots and packets and everything. And then if we have to shut down again for another month or 2, that's one plan. Some are trying to plan for if we have to start this way, which would be awful way to start a school year. So no one really knows right now, and we'll have to wait on what the governor tells us we can do or have to do, because he's been dictating, and he tells the state superintendent, which then trickles down to us, and they've been kind of calling all the shots lately. But most schools, are preparing at least 3 different plans. So I would like to start school, but if it's not safe, and if we're just going to spread it more, then that doesn't make any sense. So we might have to start online.
Just so you know, that varies from state to state.
That too.
Every state has its own game plan. Like Penn State University, they've already determined they will not be starting their school year with students on campus. They've already made that determination. A lot of the universities have done that for obvious reasons.
Yeah, online, I mean, in North Carolina, they did that as well. Like, my dad is a professor at Davidson, and they've already declared they're not starting on campus. So I think it's very different between the universities versus your public elementary through high school. Because a lot of parents, are complaining because they would like to go back to work and everything, and they can't do that if they have to babysit their kids. And they're struggling. There's a lot of parents that have been advocating to go back because they're struggling to watch their own children, and they feel like they can't teach their own children, so they would like to send them back. But to do that safely, I'll have to see what our leadership decides. And then in general, Georgia's leadership, I don't feel has done a very good job personally. And that's probably why Georgia will have a big spike, because they let us out way too early, and no one here is taking it very seriously comparatively to other states. Like, I have friends in New York and Philadelphia, and they can't believe what our state is doing. But that's a whole other problem.
We're already seeing a spike now. In fact, Florida also, some of the beaches opened up early, and now they're seeing an increase in the virus, and so they're starting to shut things down again, and they've canceled like for the month of June. So again, this is going to keep happening unless people just shut it off, stay at home, let the wave pass, and then resume life. And I know that's a hard thing to do because people need an income, they want their kids in school, we need certain things. But the only real way to stop this virus is to take away the element of how it spreads, and that's human contact. So
the concern is feeding our children, and we need to buy our food. That's really, I just had an experience at Aldi's, and someone, a man and a woman, walked away with a full cart of food without paying, packed it in their car. Yes. And one of the manager, which was a young girl, ran out. They took out the license plates of their vehicle, so they couldn't be followed. They had masks on, so you couldn't really see their faces. But people are hungry, and that's how it's really getting scary. Because I mean, I couldn't blame them. I'm like, I can't, like, what can I, that is food. You're not, you don't have a gun and trying to get our money. You packed food. And I imagine you guys have children. And so that is what's scary. What the economy is going to turn into, what's going to happen, what may happen to our safety, our way of living.
Yeah.
And yeah, I don't know, what can you, like, I know you have to leave in a few minutes, Kristal.
I still have time.
You do? Okay. I wanted to, the school situation, I think God made me and my husband do homeschooling for a year to prepare for this, because we did it 2 years ago. And then we were like, oh no, I can't. We both are entrepreneurs, so we work on our computers, and what's happening now is that our children are more on our computers, so now we know we have to invest on more computers for the house. So they're like, we got 3 kids, and even with the extra Chromebook, like, we still didn't have enough computers. Mm-hmm. So I wanted to mention these things that I've heard. I have heard that people who are using ibuprofen, Advil, and have the coronavirus are getting sicker sooner. Is that correct? Is that true, Kristal? Have you heard anything about that?
So again, going back to that anti-inflammatory response, I wouldn't say that taking Advil makes you sicker, but it will. So think of it this way. Anytime you take a medication, you take an herbal supplement, every action will ultimately cause a reaction. Okay, so there is nothing really out there to defend against this virus other than taking away the human contact right now. So could it contribute because of how it works in the body? Yes, it could contribute to people being sicker, but is it causing them to catch the COVID virus? I would say no.
No, not catch it. Let me be clear. Not catch the COVID virus, just those who do have it and take Advil can do more harm to their bodies.
Yes, it can. Because of, the anti-inflammatory response from what Advil, ibuprofen is an anti-inflammatory.
Okay.
So, again.
Is aspirin is a blood thinner.
Correct.
So you would say that would do the opposite?
Like anticoagulant.
Okay. And we don't know if that's going to help, but if somebody has a headache, and they don't know if they have it, they should take aspirin instead of Advil. It's just simple.
They should take aspirin instead of Advil because it's going to thin the blood versus thicken the blood. Okay, because the thickening of the blood is potentially causing clots.
Got it.
Right. Okay. So, but you have to make sure that you're not allergic to aspirin. Mm-hmm. Right. So, there's all these other things that you have to think about.
If you're not allergic to aspirin, because I know some people are allergic. So, okay. Anything else that you ladies, I have a lot of questions. You mentioned antibiotics, and I wanted to ask, this is one of the things that I wanted to actually bring up Ms. Samson for, antibiotics and why doctors are giving it to us when we don't need it, when we have a flu. I was overhearing her lesson to our children, and my sister just told me she has a flu and the doctor gave her antibiotics. And then I hear Ms. Samson tell me that's not going to help. She shared a story, and can you share that story with us and just tell me what antibiotics are supposed to be used for?
Well, wait. So, did they get antibiotics or did they get Tamiflu? That's different. It's two very different things.
My sister said antibiotics.
It's two different things, though.
Mm-hmm. So what I was talking about, so antibiotics are designed to work against bacteria. And then you have antivirals, which work against viruses, which is what Tamiflu is. And so I've had that before. But when I was referencing the story in my lesson, I had a virus. I was down in Florida, and I went to the emergency room. And then the doctor prescribed me antibiotics, and I asked him why, because I know that antibiotics don't do anything to the virus. And he said, it's an emergency room. I'm just trying to get people in and out. A lot of people whine, and they want to be happy, think I did my job. So for placebo effect, he was prescribing it. And I questioned him, and I said, well, that's part of the problem. You're causing resistance. You shouldn't be doing that. And he was like, oh, well, most people don't know that. Why do you know that? And I said, well, I'm a science teacher. I have a basic understanding. I mean, I did graduate with a biology major. And he was like, oh, well, so I guess you don't want the antibiotics. And I was like, no, not if you're sure I have a virus. And so I didn't get them. I didn't even take the prescription from him. And then I did call later, and I complained against him because from doing work and having a friend that works with the CDC and things, I know that they are trying to look at different areas that are hotspots for resistance. So I called and complained, and then the hospital actually just waived my bill. Like, I didn't get charged anything. So that was nice. But
You say resistance. Can you elaborate on resistance? Because
so
I don't know what that means.
So resistance is just the ability of the bacteria to survive against whatever we're trying to use to kill them. So they can just survive, essentially. So when you have like hand sanitizer that says it kills 99.9, the 0.1 that's surviving are the resistant ones. And the problem is that we go around using all this stuff so much that if you kill 99.9, you kill the weak ones, but you let the 0.1 survive that's strong. And they're the ones reproducing. And so over time, we are causing more and more resistance, essentially. And it's getting hard for all of our antibiotics to work. Like, we used to have several antibiotics that worked all the time. Now, patients are being given, like, for instance, I got strep throat a couple of years ago. That is a bacterial infection. And they had to give me basically what they call a cocktail of medicines. I was prescribed 4 different things, because I had some very resistant strain from Calhoun, Georgia, they traced it back to. But a lot of our medicines are starting not to work very effectively. And that's scary, and that's what we talked about in science class, because that is one of the top priorities of the World Health Organization, the CDC, like everyone who matters in medicine, basically, that if a lot of our medicines, 90% of them stop working, we're going to be in big trouble. And if all of them stop working, we can't do things that we've become accustomed to, like surgery or chemotherapy or anything, because those patients need antibiotics all the time to survive after chemotherapy for a while. So the resistance is being built up due to the livestock industry using it so much. That's one of the main causes. And then doctors who prescribe it when it shouldn't be, because bacteria is super great at sharing DNA, essentially, in plasmids, which I talked about the class with. And so they have their one main chromosome, and then they have tiny little pieces, like little circles, of extra genes. And they can share the genes. And so if they have a resistant plasmid, even after bacteria dies, they can like spit out the plasmid and give it to another one. And so they can share this resistant gene. Right, and so that's one problem. Like, that's why I don't use hand sanitizer very much, unless I know I'm going to wash my hands.
I've been using it.
Well, use it.
I bought it for everyone in my family now,
but you need to wash your hands after, because like Arthur gets annoyed with me because you use it, but then the dead ones are on your hand, right? So and then the live ones, the 0.1s, are on your hand, and so the dead ones can share their DNA with the 0.1 that survived, that were already stronger in general. Now you've created strong bacteria. So I only use I use it if I have to, if it's my only option, but then as soon as I get a sink. But also I use it and then I immediately wipe my hands with a napkin in my car or a paper towel to, I don't know, trying to get the dead one off. But I wash my hands. Like, the best thing you can do is wash your hands, like all the commercials and everything are saying, and count and make sure you're washing really thoroughly and between your fingers, because the hand sanitizer is one of the problems that's causing resistance out there.
Okay.
So I don't use it.
The biggest thing is, so washing the hands, it's the friction.
Mm-hmm.
when you're always wanting to wash down, not up. You're washing down, and after you're done washing your hands, you don't want to touch the faucets. You want to get a paper towel, dry your hands, use a paper towel to turn the water off so that you're not retouching.
I know.
That bacteria.
Yeah, I think about that. I hate that. Mm-hmm. I do think about, I will like use my elbow if there's, such a way to do that.
Yes. And just to kind of add on to what Jessica was talking about, because of the overuse, and it's a very prevalent problem, overuse of antibiotics, we now have what we call superbugs. Mm-hmm. So, like, you've heard maybe of MRSA, which is methicillin-resistant Staph aureus. Mm-hmm. We have C. diff, that's C. difficile. We've got VRE, vancomycin-resistant, enterococcus. So we have now, because of the overuse of antibacterial hand sanitizers, soaps, overuse of antibiotics, we have now created these superbugs that are immune to antibiotics. There are different tiers of antibiotics. You got your first tier drugs, your second tier, and your third tier drugs. With these superbugs that I'm talking about, we don't have drugs to get rid of them. We have things that will help the immune system fight them off, but we actually don't have antibiotics to get rid of them.
Right. So like, and when I was talking to the students, I had explained with what she was just saying, like if you think about it, and I think they do call them like class A drugs, B, C, D, a lot of our class A, which is like first line of defense, most of those aren't even working very much anymore. Like no one uses what was the big pink pill, arithritomycin anymore? Like it's not very effective now.
It's a derivative of penicillin.
Right. And so that one's useless now basically to us. So we eliminated a medicine. And when I talk to the students, you know, medicines are very hard to design. And it takes years to get a medicine approved. Like you got to do all these studies. And so when people are like, oh, we're going to have a cure in a year, that's ridiculous to me. But it took us years to make all these medicines. And now, like, when one stops working and we go down, and now I think the most recent stats I looked at, Kristal, correct me if I'm wrong, we only have about 65 that are currently working. And if we eliminate, we're not going to have that many left. And then when we get a lot of our medicine by studying plants in the rainforest and fungi in the rainforest, but we destroy the rainforest, I don't know what we're going to study to make new medicine. So that's another worry, where nature, I feel like by destroying nature, we're destroying our chances of new cures.
Well, we are, because every drug that's manufactured is made from a plant derivative. And so when we destroy our environment, we destroy our medicine.
Yes. I am looking at the time, and Kristal, I know you have another meeting. Please just say, Sergia, I have to go, like, you know, and I don't know how much time I have with you, Jessica. If I have a few more minutes, continue our conversation.
Yeah, that's fine.
Okay, cool. Let's go to the rainforest. Ms. Samson, you showed my children a movie that I actually joined. It was a documentary. And towards the end, it said certain things that we can do to help the planet become a better place. This whole interview really is for me to just, I love learning. I love learning about just how to make leave a better place for my children, you know? And what can I do? Like, we have actually, in the videos, one of the things were to, even if you don't eat meat once a week, we have done it. We've cut down meat for 3 times. We don't eat meat Tuesdays, Thursdays, and Saturdays.
Wow.
And I would love to be I don't know if I could be a vegan, but I would like to do more. I'm learning, you know, I'm going there with the desire to be a plant-based eater. But those are one of the things I came away with. Can you share any more of what we should be doing?
Sure, and I just want to make sure Kristal's fine. Do you need her to say whatever you just said a second ago, like bye, or?
I do, because I'm going to have to jump on my other meeting now.
It's fine. Kristal, thank you for being here. Thank you for all the information that you gave us about contact. And that, to me, I will come away with that bigger picture, because the mask really, the bigger thing is cross-contamination. And I don't know how I will grab, because I'm out there shopping, grabbing food. And yes, I go into my wallet and get my credit card to pay, and I press the buttons, you know, so I'm just praying that God puts his shield over me as I go to and fro, which is something that we do. We pray. And, you know, I'm praying for you with the work that you're doing and the contact that you have with everybody who's sick. And I thank you for YouTube being, you know, people who have decided to learn and teach other people, taking this time to teach us and to teach. I hope a lot of people get to see this video on YouTube and on Facebook and wherever else I get to put it up. But thank you for your time, for the work that you're doing. God bless you. Thank you.
Thank you. And please don't hesitate to reach out at any time if you or anyone else has questions. That's part of our job as healthcare workers, is to educate. And so, we're happy to do that. I'm happy to do that. So don't hesitate to reach out with any questions you might have.
Awesome. I think what's on my mind is definitely doing a video on how to properly go shopping without cross-contamination. If you know what to do that, go ahead.
A really great, a nurse friend did a really great video. She took paint and she had her gloves on and she talked about cross-contamination, and by the time she was done, she was covered in paint, which would be the virus.
Yeah.
And so, I think it's a visual. It's a really good visual to help people understand and then talk about how do we not cross-contaminate, or how do we limit that cross-contamination. And there are ways to do that. Maybe that could be our next segment.
That will be a great segment. Thank you, Kristal.
You're welcome.
Thank you so much. Nice to meet you. Thank you.
Nice to meet you.
Bye, Kristal.
Bye.